The World Health Organization now says it is very concerned about the spreading COVID in Africa. Initially, there had been thoughts that maybe the continent would be spared the worst of it. But as this graphic shows, the latest numbers and the transmission, especially, and most of that, by the way, is in South Africa, shows a steady climb across the continent, and there's fears that that will go even further. Rwanda is reopening its airport for international flights at the beginning of next month, August the 1st. Joining me now from Kigali is Clare Akamanzi, the CEO of Rwanda Development Board, overseeing tourism in the country and industrial development. Clare, it is good to have you. The one thing I was reading about Rwanda, it is the way in which you have used previous infections and viruses, HIV and all the others, because you've already got the testing in place and you were able to use this infrastructure for COVID. Tell me more.
Well, thank you, Richard, and very good to join you today. Well, in Rwanda, we have been working very hard, like many countries, to both learn from the science, but as well as learn how to bring the economy back to life, like many countries have been doing. And for us, what we've been able to do in order to contain the virus, today we are at 1,600 total cases, half of which have recovered and 5 have died. And so we believe that we've had a formula, and we keep working on that formula to contain the virus. And it's been mainly due to 3 things. One, it's been the trust and the partnership that our government has built over the years with the citizens. It's been extremely important to get the cooperation of the people of Rwanda, the citizens, to change their behavior, to abide by the guidelines, social distancing, washing hands, masks. And number 2, we've also been able to increase our testing capacity using the infrastructure we have in the hospitals across the country. We've built a contact tracing system of over 1,900 staff who trace the contacts all over the country. And the last thing that we've also done is increase testing. We started with a capacity of 300 tests a day. Today, we test between 3,000 and 5,000 people every day. And so those 3 things have made it very, very important for us to be able to contain the virus, and also learning from the infrastructure of the health system that we've built over the years. It's still a modest infrastructure, but it has been improving over the years.
Let me jump in here, if I may. That's excellent for Rwanda, but as the rest of Africa's numbers rise, can you prevent transmission? Land border crossings, never mind airports with negative tests. Can you actually prevent people coming into the country and ensuring they don't have COVID?
Well, we're opening our airports on the 1st of August, as you said, Richard. And we've also had our borders open for cargo because we are a landlocked country. We work with neighboring countries for trucks to move into the country. But what we've done to manage the situation has been to test at the borders. We built testing capacity with all the borders that we have in the country. We escort trucks from the border to their destination to make sure that we're able to oversee where the trucks are going and limit movement of truck drivers to the communities. So that has been important, to work with neighboring countries to put this system in place.
You know, listening to you, I'm so impressed at the level of dedication of the country. I mean, every country is doing something, but Rwanda, with limited resources in difficult circumstances, your government has clearly decided this is obviously a priority, and you're going to put in the money necessary. What more do you need by way of assistance from outside the country? Well,
it's work in progress. Containing the pandemic is something that we have to keep doing. We have to learn how to live safely with the virus until a vaccine is available. And so for us, what is really important is to manage the science part of it, the health part of it, but also be able to revive the economy. And so we've put in place an economic recovery fund of $100 million. We want to grow that fund to double, $200 million. And this fund is supposed to support the private sector and businesses to be able to cushion against the impact of COVID-19. And so for us, participating in building this fund to a bigger size, and also for private sector and investors all over the world to come to Rwanda and be able to support the businesses to grow, is something that we are creating a safe environment for.
Claire, thank you.